The gastric banding is a procedure where we place actually a band, a silastic band around the upper part of the stomach. And then with the band, it is adjustable. It has a part of it is called a port that sits underneath the skin on the abdominal wall. And through that port, we can put fluid, usually that's water or saline, into that tubing that then narrows the balloon on the band. And that will constrict the stomach. What that does is that when we eat, it gives us a smaller stomach, if you would, that then when that is filled, sends a signal to our brain that we're full with a much smaller amount of food than what you and I would normally take in. From 1990 up until today, there probably have been somewhere between 800 and 1,000 procedures done total between the two of us. The laparoscopic gastric banding we started doing in 2005 here in Tallahassee, and I think that we've done now close to 200 of those procedures here. We like to see those patients every month for a year in our office. And so if you've got to travel to Atlanta or somewhere else to have that done, that's a significant trip each month. And that's very important in doing a gastric band, is to have the follow-up so that it can be adjusted appropriately, and that if during those in-between times, if you're having a trouble that needs to be adjusted before that month is up, it's a significant expense to travel to Atlanta or Jacksonville versus staying here in town, where we do have, I think, a significant amount of expertise in taking care of these patients and are able to minister to them. Well, there is a gentleman whom we just saw back recently who actually weighed 352 pounds when we started. And he walked into the office and is unrecognizable today. He actually lost down to 204 pounds. He's off of all medications. He did have diabetes. He takes no medications for that right now. He is able to exercise more. He's able to get down on the floor and play with his grandchildren, which he couldn't do before. One of the things that Dr. Seeloff and I do is provide a monthly seminar that is free. There's no obligation to come. They're given at Tallahassee Memorial Hospital, both at the hospital as well as the Diabetic Center, both on gastric bypass. That is a separate seminar, and then there's a seminar on gastric banding and gastric sleeves that are done each month.